Okay, so let's go into a few of my 5-minute tips for learning medicine and making your life easier when you practice. So we're dealing with swellings, which is very common. So if you have a person who comes in with swelling anywhere, so what is your differential list?
So the mass can be solid, cystic, or mixed. And for cystic, it can be clear, cloudy.
Okay. So start off with any mass, say it's on a limb or a joint, then you talk about whether it's solid, it feels solid, it feels cystic, which means it's full of fluid, and then, or it's mixed. Yeah. So, okay, then if you do, say, a needle biopsy for a very cystic lesion, what should come out of the puncture? As a puncture, what are you watching out for?
In a liquid type of cyst, you can either have a clear fluid, a cloudy fluid, blood-stained fluid, or you can have pus.
Okay, so start again. Clear,
cloudy, blood-stained, and either pus.
Or pus. Okay. So the idea is actually, when you think in medicine, is to progress from clear to mixture with blood cells. Okay. So the extreme mixture is, of course, a bloody tap. Like if you're doing a lumbar puncture, then the blood comes out. It's totally bloody. Then it's bloody tap, it's blood. Okay. But it could be blood stain. Sometimes you hit the blood vessel on the way in. And the initial part of it may come out with a bit of bleeding, and then you'll stop. Or if you're unfortunate and you go in a bit too far, you tap a blood vessel, ouch. Then initially maybe clear and then follow with blood. Yeah, so depending on which part of the tap the blood comes in, you can roughly say, okay, it's probably a traumatic tap of some sort, yeah? Or you have hit the blood vessel on the way. So pus is with cloudy, where various types of cells in that fluid, okay, or crystals or some other foreign things, okay. So very useful, and this applies to any lesion anywhere, including lung biopsies if you see a cyst. Yeah, and there's so in the lung, if you have a chest X-ray, you may have a mass, okay, same, a mass which may be solid, cystic, or mixed, and then air. Okay, that's in the lung. Okay, because cystic means fluid filled, air is different. Okay, especially on X-ray, it's actually different. So now you learn from clear, cloudy, blood stain, blood, pus, air. Okay. Yeah. So this on X-ray, you look. There'll be a picture you can tell. Okay. So so I think that's quite useful, isn't it? Okay. The ultrasound appearance and all that, I think you can learn later. It doesn't matter. But the idea of ultrasound is always to see whether it is solid, cystic, mixed, air. Okay. Ultrasound. Okay. Right. So that's it. End of cyst and swellings.